'Tis the season for travel and treatment. Hello, my name is Shelby Sparby, and I'm a manager of clinical operations and a nurse at Boston IVF. We understand that this can be a very stressful time of the year, and we want to help minimize the stress and reduce the surprise of the unexpected. Today, I'll be answering some of our most frequently asked questions related to the topic of traveling during different types of fertility treatments. These are questions that we receive throughout the year, but are especially prevalent during this season. At Boston IVF, we understand that travel might be in your plans, or you might travel across state and international lines to cycle. Our general recommendation is to avoid traveling while pursuing treatment. Treatment requires multiple appointments, oftentimes with very little notice, and there are also risks when traveling in early pregnancy. Additionally, traveling during treatment can incur additional financial costs if you find yourself needing to seek care at a lab that is out of network or with an institution that is not familiar with early ART pregnancies. If you know that you must travel, please inform your doctor of record team right away so we can help coordinate and determine the impact to your treatment. Medically speaking, in most circumstances, we do not restrict patient travel before you undergo procedures, including egg retrievals, embryo transfers, intrauterine inseminations, and other surgical procedures. However, you should confirm the logistical feasibility of travel, as you must ensure that you can maintain your medication regimen, your monitoring appointments are not impacted, and your MD of record team does not have any other personalized concerns. If travel would require monitoring in an outside facility, you must find a center which can perform the necessary testing, send results to your Boston IVF care team on the same day, and align with any other individual requirements. There are certain travel restrictions which we strongly recommend in order to best ensure your health and safety after going certain procedures. Following egg retrieval or any anesthesia, we recommend that you do not travel for at least 24 hours. This is to ensure that post-operative complications do not arise and you are not experiencing any adverse reactions from anesthesia requiring medical attention. This travel delay of at least 24 hours should be applied to any patients undergoing a surgical procedure with anesthesia. Following a positive pregnancy test, we do not recommend any travel until your first OB ultrasound to ensure viability of pregnancy, typically 2 to 3 weeks after a positive result. There are no flight restrictions before treatments or while waiting for your pregnancy test. However, as stated before, we do not recommend traveling for at least 24 hours after a procedure with anesthesia or after a positive pregnancy test until we can do an ultrasound to assess for location and viability of the pregnancy, typically 2 to 3 weeks after a positive result. Of note, pregnancy, even early pregnancy, carries an increased risk of blood clots that, while rare, can be very serious if they happen. Prolonged travel and other periods of sitting inactivity increase this risk, so be sure to stay active during pregnancy and travel to minimize your risk. For this reason, if you are pregnant and traveling long distances, we recommend you stay hydrated, wear compression socks, and move around and stretch. If you do need to travel, we recommend that you make sure to plan ahead before you leave, which means communicating your travel plans with the correct parties, packing well, and preparing for additional details ahead of time. As far as communication goes, you should inform your doctor of record team right away if you plan to travel in order to receive personalized information and recommendations. It is also important to connect with your pharmacy for medication storage instructions and to understand their hours in case you need to get medications urgently or to locate other specialty pharmacies in your area of travel. When packing while undergoing treatment, it is important you pay special attention to your medications. This means you need to ensure you have medications to get you through your trip, always pack extras, and be prepared for emergencies and delays. Keep your medications in a carry-on bag rather than a checked bag. Invest in a high-quality insulated bag and cold packs to ensure your medications are kept cold to ensure medication efficacy. Keep your medications in their original packaging with the original label, which is verification of your prescription. And as always, keep your insurance card with you. Additionally, it is important to make sure you take time to research airline policies, as some have specific policies and require doctor's notes. The TSA should be your main resource with how to fly with fertility drugs. Most times, originally labeled medications, needles, and syringes are adequate to get through TSA. But if you are told you need a doctor's note ahead of travel, that can be provided by your doctor of record team. Liquid fertility medications can exceed the 3.4 ounce limitation, so you should always notify the TSA office right at the security checkpoint. TSA has a helpful video on their website with information about traveling with medication and checkpoint screening processes. They additionally have a dedicated helpline to answer any questions you have. It is recommended that you call 72 hours prior to departure. Finally, once you arrive, make sure that you are planning ahead when it comes to taking medications on time, especially if you're changing time zones, and ensure your medications will always be properly stored by checking your refrigerator's temperature settings. I hope this video helped to answer some of your questions about traveling during family building treatment. Remember, you should always communicate with your doctor of record team, as everyone's family building journey and care is unique. If you have other questions, we are always happy to help, so feel free to contact us via our website, www.bostonivf.com. I hope you have a happy season and year ahead, and all of us at Boston IVF wish you the best of luck during your family building treatment. Take care.